The duodenum definition and location. Duodenum is the widest and most fixed part of the small intestine. The duodenum is the widest and most fixed part of the small intestine. It extends from the pylorus to the duodenojejunal flexure. It extends from the pylorus to the duodenojejunal flexure. Length and parts. Duodenum is 25 centimeters long. It is divided into the following four parts. First or superior part 5 centimeter long. Second or descending part 7.5 centimeter long. Third or horizontal part 10 centimeter long. Fourth or ascending part 2.5 centimeter long. Duodenum is total 25 centimeter long. First or superior part 5 centimeter. Second or descending part 7.5 centimeter. Third or horizontal part 10 centimeter. Fourth or ascending part 2.5 centimeter. Second part of the duodenum. Part of the duodenum which begins with the superior duodenal flexure and end at the inferior duodenal flexure. This part is about 7.5 centimeter long. Its relations are as follows. Second part of the duodenum, which begins at the superior duodenal flexure and end at the inferior duodenal flexure. This part is about 7.5 centimeter long. Its relations are as follows. Peritoneal relations. It is retroperitoneal and fixed. Peritoneal relation, it is retroperitoneal and fixed. Its anterior surface is covered with peritoneum. Visceral relations. Anteriorly, right lobe of the liver, transverse colon, root of the transverse mesocolon, small intestine. Visceral relations. Right lobe of the liver, anteriorly, right lobe of the liver, transverse colon, root of the transverse mesocolon, small intestine. Posteriorly, anterior surface of the right kidney near the medial border, anterior surface of the right kidney near the medial border, right renal vessels, right edge of the inferior vena cava, right psoas major. Posteriorly, anterior surface of the right kidney near the medial border, right renal vessels, right edge of the inferior vena cava, right psoas major. Medially head of the pancreas, medially head of the pancreas and the bile duct. Medially head of the pancreas, the bile duct. Laterally right colic flexor, laterally right colic flexor. The interior of the second part of the duodenum shows the following special features. The major duodenal papillae is an elevation. The hepatopancreatic ampulla opens in it. The major duodenal papillae is an elevation. Hepatopancreatic ampulla opens in it. The minor duodenal papilla presents the opening of the accessory pancreatic duct. Minor duodenal papilla presents the opening of the accessory pancreatic duct. Arterial supply. Up to the level of the hepatopancreatic ampulla opening, the duodenum is supplied by the superior pancreatico-duodenal artery. Up to the level of the hepatopancreatic ampulla opening, the duodenum is supplied by the superior pancreatico-duodenal artery. Below opening, duodenum supplied by inferior pancreatico-duodenal artery. Below opening, duodenum supplied by the inferior pancreatico-duodenal artery. Venous drainage. The veins of the duodenum drain into the splenic, superior, mesenteric and portal vein. Veins of the duodenum drain into the splenic, superior, mesenteric and portal veins. Lymphatic drainage. Lymph vessels from the duodenum end in the pancreatico-duodenal nodes. Lymph vessels from the duodenum end in the pancreatico-duodenal nodes. Nerve supply. Sympathetic nerves from the thoracic ninth and 10th spinal segments. Parasympathetic nerves from the vagus. Sympathetic nerves from the ninth and 10th spinal segments. Parasympathetic nerves from the vagus. Clinical anatomy. Duodenal diverticula. Duodenal diverticula, they are seen along its concave border, generally at points where arteries enter the duodenal wall. Duodenal diverticula, they are seen along its concave border, generally at points where arteries enter the duodenal wall. Congenital stenosis and obstruction of the second part of the duodenum may occur at the site of the opening of the bile duct. Other causes of obstruction is an annular pancreas. Congenital stenosis and obstruction of the second part of the duodenum may occur at the site of the opening of the bile duct. Other causes of obstruction is an annular pancreas. X-ray taken after giving a barium meal. X-ray taken after giving a barium meal.